Doctors overread it. What was the most shocking case of I thought that was normal you've seen in a patient? When I was a medical student, a patient and his brother came in together. Patient was just a post-op visit after a hernia repair. Found out he had another baseball-sized hernia. His brother, on the other hand, had literally had a football-sized hernia visibly coming out of his left leg of his shorts. Looked like an inguinal hernia, and he was able to use it as an armrest. I asked him if that bothered him at all, and he straight up said my brother's hernias were painful but this isn't. So I thought it was just a quirky defect. I hope he was lying to save face, but we recommended he get it taken care of. Nurse here, 67 years old, thought she was pregnant. Gotta say, she looked pregnant in that it was all in her abdomen. Like some pregnant women who look like they're carrying a basketball when they're at the end. But she was 67. Turns out it was a 37-pound ovarian cyst. I asked if I could watch the surgery. That thing came out all in one piece. I'll never forget the sound it made. This was at a community hospital many years ago, before HIPAA, so naturally the lab announced that anyone who wanted could come down to the lab and view this incredible thing before it was dissected by pathology. The line at lunchtime was so long you'd think they were giving away free concert tickets. Holy crap. 37 pounds that's a big imaginary baby. OBGYN here. I've pulled so many things out of vaginas that people claim they didn't know were in there or don't think it was abnormal to leave them in there. Old rotting medical devices, what looked like a plastic car wheel or bottle cap, used condom, old tampon, insects, you get the drift. MD here. A couple years back, had a walk-in complaining of a few months of abdo pain swelling. I crap you not. The man was Simpson's character Yellow with jaundice and ascites, fluid filling the belly. He seemed shocked when I told him I was calling the hospital to arrange direct admission. Ahem. Please continue. When I was a med student we visited a clinic in the country where I studied. Lots of people get horrible injuries and use the local elixir of dirt motor oil spit from the local old lady to patch up an exposed arm bone, or whatever. Had one woman in her 20s come in with a fungating breast cancer that looked like a hard mushroom ball growing through the skin into the outside world. Constantly bled anytime you touched it. Her family shamed any injuries or impurities and she thought she just needed to keep it covered until it got better. I don't know if this fits, but here's a story about my husband. We were messing around and he chased me through the kitchen, took a hard left turn and lost his footing, fell on his side. He's a big dude, so falling is a bit more traumatic for him. He couldn't put pressure on his leg and knew immediately he was hurt pretty bad. He was able to crawl to the couch, and once settled said he wasn't in too much pain. He decided to sleep on the couch that night so he wouldn't have to go upstairs. We made an appointment in the morning for the so we wouldn't have to sit there all day, but they didn't have an opening until 2. So we just hung out at the house. He was in a decent amount of ambient pain, but it didn't seem emergent. Once we got to the hospital, we find out that he had broken his hip, in this case breaking off his entire ball joint from the top of his femur. The nurses said they couldn't believe that he was able to sit up and had slept on it, implying that we should have come the night before, and probably by ambulance. It required surgery with some hefty bolts to put it back into place. But the crazy part is that apparently a healthy 30-ish-year-old man breaking his femur from standing is highly unusual. After several tests and an MRI, it turned out he was in the early stages of osteoporosis due to a pituitary tumor in his brain. So we discovered a benign brain tumor all because dude was wearing slippery socks. Edited to correct the type of tumor. I had the wrong gland. I'm making my internship and one night I was attending a TRIG. A TRIG is the area where you check the patients and decide how urgent is the attention they need. Context here, I'm in a third world country and I'm at a public hospital that attends uncovered population, and instead of one hospital with all the specialities we have 3. The main one, the Geo hospital, and the children's hospital. So I had this woman of late 30s. She started telling me that she had an extreme pain, 10/10, in the lower abdomen. No other sign that food could be involved, neither kidney stones or urine infection. I proceed to ask about last menstrual cycle. She doesn't recall the exact date, but she says it was like 4 months ago. Without hesitation and without asking more or anything else I told them she and her familiar to go right away to the hospital that was crossing the street, because if it was something obstetric we didn't had any gyno in this hospital, and if it was something of general surgery they had general surgeons there. We got a call like 20 minutes later, lol. That woman delivered her baby at Tridge of the other hospital. MD here. Had a patient come in for cast removal literally years after it had been put on. She had just decided it wasn't worth taking off. Her leg skin was literally growing over the top of the cast and then down it. Once we finally cast the cast off, she was surprised to find that she had no skin underneath, but the dead tissue over her muscles and bones was being cleaned by about 300 maggots. I knew by the smell that something under there wasn't right, but wasn't expecting that. Patient seemed completely fine with it, whatever. Resident doctor here, although not an obgyn. In my obgyn rotation in medical school, I had a patient who was a first-time mother having difficulty nursing her baby. The patient said she had some redness and it had been hurting to nurse on one nipple, so she often had to switch until finally it became unbearable for her to nurse from either. She had mentioned that she thought her nipples might be cracked or chafed. When it finally came to the exam, she had the most chafed nipples I had ever seen. It looked totally raw and macerated to the point that they looked like 2 large pepperoni slices. One of her breasts also looked like the wound had led to mastitis. It definitely led to a new appreciation of how difficult breastfeeding can be on new mothers. OMFG, my vag just sew herself closed. Not a doctor but related story of major illness undetected. My son, 13-year-old, complained to me that his scrotum was unbearably itchy. I figured probably sweat. Told him to wash the area thoroughly and make sure to dry well. Maybe dust some baby powder on there too. A couple of days later he said it was still itchy and getting bigger. Bigger? He showed me his visibly swollen scrotum. No pain or anything, just itchy and swollen. So that's not good, but I didn't think it was anything more than a sweat rash that maybe needed some ointment. We go to the doctor and are sent off for an ultrasound. The scan shows 0 blood flow to the area. Immediate transfer to the emergency room. He goes in for emergency surgery where the urologist surgeon removes one necrotic testicle. It had become randomly twisted, testicular torsion, and died at least a week prior according to its necrotic state. The swelling was a major infection setting in. The itchiness was caused by the infection and skin stretching. He had no pain whatsoever and the doctor said that was amazing. For most boys, torsion feels like being kicked in the nuts continuously, and by the infected stage he was in, he'd expect crying and screaming level of pain. Much longer and he could have developed sepsis. We just thought it was a bit of a rash that got out of hand and are lucky I took him to the GP and didn't just go buy ointment OTC as I had thought of doing. He had a follow-up surgery a month later to insert a fake testicle and to stitch his remaining live testicle to the scrotum wall so it can't commit seppuku like its brother. Psychiatrist here. One of my first patients was a female college student that couldn't sleep because of the voices that constantly talked to her and she felt forced to answer them at all times. From what she was saying I gathered that depending on the particular voice, with name and identity, she was either cautioned about some people or situations or outright pushed towards violent acts. Her voices appeared when she was 16 if I remember correctly, and we've met when she was 20. So at that point for 4 years of her life she believed that it was normal to have such voices in your head, because, as she explained, many people talk to themselves. To some extent she was right, but I had to explain to her that they really talk with themselves, that there are no other identities in them, but only an internal dialogue to clarify or resolve issues that bother them in their own privacy, so to speak. She was later diagnosed with schizophrenia. It's interesting because obviously we have the phrase, talking to yourself, but for neurotypical people, it's assumed that you won't get an answer. Healthcare worker here. I ran into a patient who had one or possibly both heads of her biceps completely ruptured proximally and curled back on itself so she looked like Popeye. I sheepishly asked her about it and she just shrugged and said it didn't hurt so she didn't worry about it. You do have 3 muscles that flex the elbow, but still the biceps is pretty important. Ag. I can't express how much I dislike this. Patient here. Went to the doctor for a no to have a day off work since I didn't feel great and just didn't want to work. Doctor poked me in the stomach, said that's not normal and sent me off to have a scan, which took me 2 months to get around to. 2 weeks later I get a letter from the doctors asking me to come in. Change my shift, so I go, and the doctor went off at me for not coming in sooner and told me to go home and pack a bag. I'm off to the Royal Brisbane. It might be cancer. More scans later and it's decided that it's not cancer. It was a 4 kilogram cyst. My only symptom was an enlarged stomach and the "you're getting fat" comments from my mother. Shout out to the RBWH for being a tops place for various things. Always average to above good experiences there, honestly. Not a doctor but have a story. My oldest son was 11 years old and needed a physical for youth tackle football. We had a new doctor, so she went into more detail than most physicals. He had complained that his ankle hurt during the middle of baseball season, so she asked if he could take off his shoe. When he did, she immediately points to the side of his foot where there was a strange bump and informed us he had a broken foot. I didn't believe her as I pointed out he had the same thing on his other foot as well. She took a look and said, "Oh, he has 2 broken feet," and sent us over to get x-rays from the hospital. I was laughing thinking this was so crazy, believing there was no way my son, who not only finished playing in a baseball tournament, but who was running and jumping at the swimming pool literally an hour before, had 2 broken feet. After the x-rays were completed, my smile quickly faded as the doctor was right. That is when we learned about completely flat feet and the damage stress fractures can do when they go undetected. 8 weeks of cast and special shoes and insoles for the rest of his life solved the problem. His feet are still deformed, but it never slowed him down. Work at a dentist's office. Patient presents for an exam. Concerned part of her tooth has chipped off. On examination, it is not in fact a tooth that chipped off, but rather a piece of calculus, which is buildup of hard tartar that covers your teeth over time when you don't brush them. It can be small deposits, or in this case, an entire bridge covering her actual teeth. She thought the calculus was tooth material and was quite shocked to learn we were actually unable to see her real teeth and she'd need an extensive cleaning to remove it all. A piece of calculus. I knew my suspicion that math was unhealthy was justified. MD here. Patient came in saying he was feeling a little tired and noticed he was having a harder time doing his job in construction, a particularly difficult type of construction. Turns out he had slowly lost 80% of his blood over the course of a few months. Dude was a badass to be working as hard and long as he was with only a fifth of normal blood volume. Hemoglobin was low 2s. MD here. I had a patient that had such uncontrolled diabetes that he lost all sensation in his legs. He came into the hospital because he saw some blood on his socks when taking them off. Turns out his foot was literally rotting off, almost completely gangrenous, and the blood was coming from a huge ulcer at the bottom of his foot, which had maggots living in it. Not a fun day. Not a doctor, but a patient. I went in for thigh, hip pain. I couldn't lie on that leg for more than 30 seconds without pain. I thought it was muscular and my doctor thought it might be radiating back pain. I had several x-rays and learned I had broken my hip sometime in the past, had a floating bone chip in my hip, degenerative disc disease, a birth defect in my spine, and mild scoliosis. I was the patient, misdiagnosed when I had Crohn's disease so bad, I was literally starving to death. Finally got to a gastroenterologist, and he ran the right tests. He actually told me he thought I was too far gone to recover. I was 21 years old, 6 feet 5 and 131 pounds. I am also 6 feet 5 inches with Crohn's. Mine was easier to diagnose because I went to the doc stating I have this symptom and 2 uncles and 1 aunt with Crohn's. Sent to gastro and diagnosed right away. The family history was helpful, because they don't seem to test for Crohn's early in the diagnosis process. This was 20 years ago. Glad you were able to get back on your feet. Patient here. I thought everybody got itchy when playing outside. Turns out I'm allergic to every pollen grass mold in the state, and I shocked the doctor during my allergy test when she came back and my whole body was red lumpy. Kind of similar to this. I always broke out in hives on my legs in gym class or when I would exercise growing up. In high school, a dermatologist finally discovered that I'm allergic to my own sweat. She said she had seen a couple cases of it throughout her career. I take a daily allergy pill now and I'm fine, but definitely a fun fact I can bring up. Not a doctor, but I was rushed to the ER when I was 23. When I got there, I was admitted as an undiagnosed type 1 diabetic. The I thought this was normal bit is that, while living undiagnosed for about a year, I dropped 100 pounds. I weighed 120 pounds and was as weak as I was frail. I had stopped going to the gym months beforehand, so I just thought, well, I was as skinny as a kid. Makes sense I would get this small if I stopped eating and working out. Patient here. My psychiatrist saved my life. I have always had heavy irregular periods, so when I had bleeding that didn't go away for a month, I pretty much just kept on keeping on. Eventually a doctor referred me to an emergency department because of the constant blood loss. I got told it's because you have endometriosis. So for 5 months I had a heavy period, with doctors just dismissing it. Eventually my roommate called an ambulance when I passed out in the shower. The doctors did a blood test and I was admitted overnight for a blood transfusion. Fun fact, blood transfusions make some people nauseous, which is not a fun way to find out you're allergic to an antiemetic. A few weeks later, at about the 6-month mark, I drove for an hour for my regular appointment with my psychiatrist. He took one look at me and told me proceed directly to the emergency room. Do not pass go. So I did, and was promptly admitted to ICU with a bilateral pulmonary embolism. I was hours away from suffocating to death. Turns out all the birth control that the original doctors had been giving me to shut me up and get rid of me had caused mass clots. The doctor that looked after me and ultimately saved my life wrote a paper on why it's stupid to ignore a nulla gravida, never pregnant, woman in her mid-20s with severe dysfunctional uterine bleeding. I would love to hand that paper out to all the doctors. I was that patient. I thought I just had some bad personality qualities. Turned out it was a rare kind of schizophrenia. I'm not a doctor, but I did used to work in the emergency department of a pretty big hospital. This one lady came in with complications with her pregnancy. Apparently, a lot of things were going wrong, but she just thought that was part of pregnancy until someone pointed out to her it was not. It turns out she had a miscarriage. That was not a fun day. You never forget the cry of a mother who has just lost a child. Paramedic here. Once saw a lady in her late 50s with a goiter a little larger than a fist. She had been otherwise healthy her entire adult life, and had not once seen a doctor about it because her brother and father had the same thing, so she assumed it was just a genetic thing that she had inherited. I was the patient and it wasn't as crazy as some of these stories, but I got my eyes examined and found out I have terrible vision. I'm almost legally blind in my left eye. When the doc had me cover my right eye and try to read the letters, I couldn't read a single one. The eye doctor actually laughed at me. I was 21. I just thought everything just looked the way it looked. Getting glasses for the first time was mind-blowing. Not a doctor, but I was talking with a few girlfriends and I casually mentioned that I hadn't had a period in 3 months, and that when I do have them, they're either 2 days or a month straight. I did not know that was not right. That's the same for me, and whenever I go to any doctor for anything and they ask when was my last period, they look so worried and give me a PT, and I hate it because I sit there awkwardly with that yep face while waiting for the results because I know I'm not pregnant, but they're staring at me like my life is about to change forever. I was the patient. I had Roux-en-Y gastric bypass in April 2017. After I went home from the surgery, the expectation was that I would be on a liquid diet for a week, and then slowly start reintroducing soft foods, etc. I even used a check-in app that reviewed how I was feeling, to monitor if something was wrong. 2 weeks in, and I still couldn't keep down an ounce of protein shake. My now ex-husband was getting frustrated with me because he thought I was being deliberately difficult, while he was gone to a city 3 hours away by plane. I woke up in the middle of the night heaving and dry vomiting. My mother drove me to the hospital in the middle of the night, where I spent the next 12 hours having every test imaginable run on me. Turns out within 24 hours after my surgery, where my intestine was reconnected at the Y junction had actually come apart, leaking anastomosis, if you want to look it up. And everything I'd tried to eat had just been draining into my abdominal cavity. I was septic, and had 4 large abscesses. After emergency surgery, I spent 10 days in the ICU recovering before I went home. The surgeon told my mother that if I'd been even 24 hours later getting to the hospital, I wouldn't have made it. Side note, less than 2 months later, my husband left me. Oh no, I can't even imagine what that must have felt like, and frick your ex-husband. Sounds like a real piece of work. Patient. I thought I was having a really bad flare-up of my arthritis in my back. Finally went to the ER after puking for a few hours and only being able to either lay completely flat or curled into a ball. Turns out I was extremely dehydrated, had an inflamed gallbladder, a really bad UTI, and my kidneys were starting to shut down. I bet you drink water by pound now. I had a few UTIs and it knocked me out. I don't know how peeing hurts so bad like that. I'm the patient. I had extensive endometriosis that was never caught by my first gyn. I was having a CAT scan for kidney stones and they noticed shadows on my ovaries, so they advised me to get them examined. My second gyn did some sonus and they couldn't find one of my ovaries, so I said, like, you mean my ovary took a vacation without me or something? I went for an exploratory lap and the endometriosis was so bad they had to call a surgeon and to cut me open, and another obgyn in for an immediate second opinion. They did find my missing ovary stuck to my uterus with scar tissue, nowhere near where it should have been. LOL. That's a horrible situation and hope you're doing better. Your comment about your ovary going on vacation without you made me chuckle. Patient here. A few summers ago I was going into my 4th week with a headache, but since I suffer from migraines I figured it was just part of it and my medicine was beginning to stop working. My friend convinced me to talk to my doctor to at least get checked up, and it turned out I had a dent in my head towards the middle of my scalp, and a concussion. My sister and I had wrestled a month prior and I got kicked, but I didn't think anything of it since I've had concussions before and they felt different. I had to take time off of work and basically nap for a week to heal. Patient. One day my stomach area just started randomly hurting really bad. I thought I just had a regular stomach cramp. After 3 hours of the worst pain ever, I went to urgent care and it turns out I had appendicitis and my appendix ruptured in the worst way. I had surgery to get it removed the same night. That was 5 days ago. Get off Reddit. Don't make yourself laugh or cough. God, I shouldn't be reading these. I just got surgery on my dong a couple days ago because it was bent too much. It was specifically 65 degrees bent downwards, and that was my "oh that isn't normal" moment. But I shouldn't be reading these because I'm still scared something wrong is going to happen to my genitals. Also, now that I know that what I had wasn't normal, then why do people use bananas as sexual innuendos? I mean, bananas are also way too bent out of shape. In all seriousness, sending good healthy dong vibes your way. Patient here. I had been suffering from debilitating pains basically since I was 14 years old. They would be worse around my periods and kind of dull down a little after. I was told this is normal. At 18, I started searching for answers because the pain was getting worse. I went 7 different doctors in 6 years. I was either dismissed as it being normal period pains or being misdiagnosed. One doctor tried to tell me it was irritable bladder syndrome. I'm no medical student, but even I know that's not a real diagnosis. I was on all kinds of different birth control and pain medication which didn't help. At 23, I was finally able to see an OBGYN who specializes in pelvic pain. She barely even touched me before she was saying, "Oh my, you have endometriosis," and scheduled me for the first laparoscopic surgery in January. During that surgery, not only did they find that I have the highest and rarest severity of endometriosis with complications, but they removed several golf ball sized cysts that were ready to rupture. She told me I must have a really high pain tolerance because I should not have been able to walk upright into her office that day with everything that they found and removed. The most amusing part of this, before seeing the specialist, I had 3 ultrasounds and several other exams, but no one detected or even bothered to look for endometriosis or PCOS. It was that simple pelvic exam that saved my life. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.